Yeah. Check the mic, 1, 2, this ain't no drill, this is the truth. From Rochester streets, here to veterans, youth, and the wisdom of ages. Battle hardened and true, combat news on the air, breaking through for me and you.
Welcome, everybody, to another episode of Veterans Open Forum presented by Combat News. I am your host, Sarge, with Bill Adams and Blank, of course, two awesome representatives here from Combat News. We are Combat News. And we're going to bring you a little video podcast talking about some things that were brought up throughout the Veterans Open Forum. We're going to talk about some of these things in detail, get to the nitty gritty, and see what you guys think about this. So without further ado, Bill, do you want to do your thing?
Yeah, man. So welcome to the Veterans Open Forum brought to you by Combat News, where we put veteran policy in perspective. Veterans Open Forum is an open group held by vets for vets and our special guests. We're not aligned with any political party. Our focus is only our veteran needs, veteran issues, and who addresses our veteran needs best. We provide a safe space for veterans to voice our opinion about the issues that affect us most. Tonight, Sarge, we're talking about some big VA issues, some very
Absolutely.
large issues that affect all of us.
Absolutely, we are, Bill. And I know you have a couple things that you've done your due diligence on, and I know everything is near and dear to your heart, but near and dear to all of our hearts as a team. And we appreciate you doing your due diligence to make sure that we, as Combat News, bring the proper facts and information to the veterans, the information that matters most, right? I mean, this is our news. This is not the local news. This is not CNN. It's not Fox News. This is veteran news here. So, Bill, what do you got for us today?
Well, one of the things we're talking about, there's this big thing right about now with veteran workforce cuts and the reorganization and all that. And so, as the debate intensifies over staffing reductions at the VA, major reorganization to raise fresh concerns. What's going on with the VA healthcare? So the leadership in Congress is moving forward with a plan to realign the healthcare workforce by shifting away from facilities that are in declining veteran population areas. And they're trying to go into centralized hubs in states where the veteran population is growing, like Arizona or Tennessee. And they're saying the idea here, the goal, is to reduce the administrative overhead and better align with the demand of the veterans. It makes sense. The critics are arguing, though, the plan significantly reduces the workforce, and there's some people on the Veterans Affairs Committee that are, complaining that 40,000 employees in fiscal year 2025, and that, nearly 90% of the reductions came into healthcare and supporting roles and doctors and nurses, and the officials in the VA refute that. And they're saying that no care is being compromised whatsoever. They're pointing to the average wait times that are being, stable, and the trust scores among veterans are being high. But there's a warning now about the shifting of the employees out of these facilities, and so they can better serve the veterans in rural areas. And they want to make sure that they can not struggle to recruit these clinicians in these different areas. So as the staffing tightens and the veterans are increasing to private sector providers through the community care program, right, there's growing concern that the private sector framework will take away from the VA care. So the workforce reductions are really accelerating this pain and suffering that the Congress is feeling about the veteran health care being privatized. Well, the central question right now is whether Congress is facing this organization, whether it improves access and delivers better care, or it's just a reorganization for the sake of reorganizing. So we're hoping that it does, in fact, help us.
Yeah. And this reorganization began in what, early 2026?
It's actually July 2025 where they projected they wanted to get rid of 80,000 people, right? And so they're like, we'll get rid of 80,000. Well, they just out of attrition by July 2025, they reduced 30,000 employees, right, through voluntary measures, including resignation, early retirement, normal attrition. All right, so basically 484,000 employees as of January 2025. That's down from 467. So it reduced at 3.5% of 17,000 already, just on top of that 30,000. So now fiscal year 2025, they're looking at 88% of the departures are going to be absolutely nothing to do with voluntary exits, attrition, dismissal of probationary employees. People are doing spreadsheets and PowerPoints. Those are all gone. So nothing to do with
Yeah.
healthcare, only to do with the administrative overhead and burden.
Yeah, because they did say that they were worried about the impact to care. When I was reading, they said, the primary concern of for veterans is whether these cuts will lead to longer wait times. The VA claims efficiency gains will offset the smaller workforce, while advocates worry about the brain drain of experienced medical staff. That's what I read as
Yeah.
one of the things that they
Yeah, well,
that's
they
what they
said under
said.
a reorganized, see, this is the VHA side, so the health administration side. So under the policymakers, they're saying that the focus on implementing these policies, the clinical leaders will focus on what they do best, taking care of the veterans. They won't have to worry about the administrative overhead and gobbledygoo to go through getting that done. So we're hoping that's good.
Yeah. Yeah, that is
So
pretty
there's a
crazy.
longstanding issue about 2016 Government Accountability Office report that said that there was a tremendous amount of deficiencies and overlapping responsibilities. So that's what they're trying to get rid of, is that you got 17 people doing the same job in the same place for no reason. And has nothing to do with healthcare.
And also, I was reading here, it says the wait time metric. While the VA claims wait times for established patients remain low, around 5 to 10 days, wait times for new patients seeking specialty care like cardiology and neurosurgery have crept up to an average of 36 days in some regions due to a hiring freeze and non clinical support staff who scheduled those appointments.
Right. And so a lot of that is because of the way that the second segment we're going to talk about, which is the private sector healthcare contract and the
Mhm.
reorganization. That's a lot of the reason why. So these things dovetail exactly together. Is
Got
that
it. Yeah, let's.
this entire thing with the workforce cuts and reorganization, and then the entire thing that has to do with the massive private sector healthcare contract, they're reducing the entire administrative overhead from a giant amount of overhead to just two, which is amazing. Yeah. So
Gotcha.
yeah, they're going from 5 different regions to two.
So with the VA's massive private sector healthcare contract, what's the core issue? What's going on with that?
Okay. All right, so here's the situation. The way the contract was written before, first of all, this is up to $1 billion contract. This is massive. It's the biggest contract that they ever have done in the history of the government, which is kind of cool. But the bottom line is this is going to give competition and performance incentives. And there's a flexibility so they can bring on multiple vendors and make them compete. The old program was, "Here, you got the contract, you're good. We don't really manage you, you just have to fulfill your contract requirements."
Got it.
Now, they're making competition. If you're not managing these veteran healthcare metrics, you're gone, we'll bring somebody else in. And this also opens up the entire door for that chit system they were talking about, where they can pay people underneath that are not necessarily within the system, but are providing assistance outside, like the people who are doing the MDMA and those kind of
Yeah.
things. Those now can be certified underneath this program because it now has a payment process where they can slide in. Makes
Yeah.
perfect sense now. It's
I'm all
really, really
about
working
the
out well.
I hate the word privatization. I love the word freedom. I love the word freedom. That's what we fought for, and I truly believe that we should have our freedoms, freedom to choose where we need to go for our medical service, how we need our services, when we need our services. I don't like the private. To me, I feel like they use the word that critics use, privatization, as scare tactic. That's my opinion,
Exactly.
because I believe it comes down to freedom. I believe everybody should have a choice to go. If you know a local dentist that, you know what I mean, and you want to support your local dentist, why can't you go to your local mom and pop's dentist? Why do you got to go to, a big dental company with 14 dentists in there?
Agreed. Agreed.
Yeah.
So what's interesting about this is that, yeah, they're talking about the wait times. They're talking about the drive times, other factors. But the one thing is that they're looking at 100. I mean, think this through, right? The VA did 127.5 million healthcare appointments last year. That's crazy, right?
Yeah.
Additional 3.5 million procedures outside in the community. So it's really a very small percentage of all of the things that are happening, and it's only the specialty things. I mean, community care is there because the VA doesn't have it makes no sense for them to have a specialist on staff to be busy 20% of the time, right?
Mhm.
So let's use that specialist in the community to do that for the veterans so that we don't have to keep that person sitting around on their thumbs for 80% of the time. Makes sense.
Yeah. Yeah. So how do you feel that this is going to help the veteran community?
Well, it's going to dramatically improve the ability to provide the health care and choose the provider and the location for the veteran that we're what you're talking about is exactly what's going to happen is that you're going to have a much wider net of doctors and services outside of the VA for the specialty care that you're
Yeah.
looking for that will be that will be easier to be referred to from your primary care physician.
And I did see something about there said something about with nearly 40% of VA care now happening in the private sector. These third-party administrators like Optimum or TriWest effectively act as the middlemen for the entire veteran health
Exactly.
ecosystem.
Yep.
Yeah.
Exactly. So think this through, right? So you have the electronic health record, and then you have this payment record. Okay. So you get referred to a doctor in the community. That payment method guarantees that doctor will be paid within 30 days.
Mhm.
Guaranteed. That's part of the contract. Now, whether that doctor sends back your meeting notes electronically to you, no idea. But that billing record is
Yeah.
done electronically. So the
Yeah.
electronic health record isn't as prioritized as the billing. That's probably why this is being changed.
I really don't think also when people talk about it's going to drain the resources from, I guess you could say brick and mortar VA hospitals, that specialize, I guess, in VA specific trauma. I don't think it's going to do that. I think it's going to ease up a little bit of their backlog, you know what I mean? And make things a little bit more fluid. I just don't we're never going to go away from no VA. It's just going to think will help the VA move a little bit more fluid by having a system in place where the veterans can get help in between. I mean, I use my wife's insurance for dental, but having a dentist in between, I go, dental at the VA, it's epic. You know what I mean? 2 cleanings a year. You get, you know what I mean? You get to, if you need, okay, I'll have you do the cavities and then the VA do that. It's nice to have freedom. It's nice to have choice. It works a
Agreed.
lot better
Yep.
that way. Yeah.
I can tell you that I as much as privatized healthcare would probably be better, right? As we visit it sometimes with the VA, I can tell you some of my experiences has been that I didn't want to go to the public sector because the wait time was twice. I'll get a good example. I had some moles on my up here. I got in a week. I already got a letter back saying you're okay, Sam. I was told I was at least 6 to 8 months out in the civilian sector. So if the VA didn't have that program, I would have waited 6 to 8 months, and what are they gonna do? Sorry, I just c there's no doctor in your community that can do it right now for 6 months. Do you see what I'm saying? So, I say that sometimes it's a good thing, and maybe sometimes it might be a bad thing.
You're saying they're waiting sick. They couldn't get a doctor for 6 months to do that, a dermatologist
Yeah,
in the
so the thing about it is that, for example, a sleep study, right? I mean, I had need a sleep study. I went to my doctor in January, first week of January, and I had 2 options. One, I could have let the VA do some type of video thing for this sleep study. I don't know how they would do it, but they would do a video thing. Or I have to go out in town. I chose to go out in town because how are they going to do this weird video thing, right? I set my appointment today for September 9th. Yeah. So as soon as they can get me in.
wow.
So I'm just saying is that we as veterans sometimes complain about the weights and this, that, and the other thing. I think we should, like said, some of this stuff isn't out of the civilian sector is twice as bad. And then I guess what I'm trying to say is now we go to the VA, say, hey, we want private, we want to be able to go to our own doctors, and the VA gives that to us. And then what happens is just what happened. Hey, I need a sleep study. Okay, set your appointment for September 9th. Just like every other asshole in the world has to do. See what I mean? And the dermatologist was they couldn't get me. They couldn't even get me in July. They were like, maybe July we can get you in for dermatologist out in the civil, community care. But I was able to see them last week. They were able to take pictures and everything was good to go, right? So I'm just saying is we as veterans, I don't know that every single area is the best. So if the VA goes one day and goes, privatize healthcare, that's what we're going to do. You pick your own doctor and you go out there. We might be up a creek without a paddle and we're like, hey man,
yeah.
I got this special disease because you fucked me up. And they're going like, yeah, but you got to wait 8 months to see a doctor. Good luck. Don't die.
There was something that came up that I also seen. There was a shift into care. It says we're seeing a historic tipping point, and in 2021, about 25% of care was private. By 2026, we're approaching 45 to 50%, give or take. This is no longer a supplemental program; it's becoming the primary way many veterans receive care. So it seems like it's almost the inevitable. I just hope that they still allow the veterans to go to the VA. You know what I mean? Like, I hope it's not just go out. They should still allow the veterans to have their care through the VA. But once it reaches a certain max, then they can go out to, it's easier to get out to the private sector, I should say.
Well,
Or if,
I know
I mean,
that
but if a veteran wants to do it though, blank, if a veteran says, hey, I don't want nothing to do with the VA system. Hey, more power to you. You know what I mean? Go find a
yeah.
doctor, go, do
But
your
what
own
I'm
thing.
saying is if eventually that 40-50% turns into 70-80%, right? And the VA is going to say, well, why are we even here for the 20%? Let's just dole the 20% out. See, some guys like Bang Reeves, he's told me how much he has private health care. He's a retired cop.
Mhm.
He goes to the VA because everything's under one roof. I need an x-ray, I go down the hall. I need my blood work, I go down the hall. I go down everything's there. He loves it.
Yeah.
You know what I mean? And what I'm saying is that if we bitch about VA so much, like I said, just a dermatologist, I got in a week. I got an answer back. They already sent me a letter saying you're good to go. You're not gonna die of that, pal. And I'm just saying is that if I would have waited for the civilians, I would be looking June, July. And if I go to the VA and say, hey, I need to be seen, and I go to the patient advocate and bitch, she's gonna tell me we're doing the best we can. Find another community care provider. You know what I mean?
Yeah. Yeah.
Now I'm up a creek. Now I'm making calls to the doctor's office, and now I got to deal with the VA authorization number, and I got to deal with this, and I got to fucking try to find a doctor that'll see me. It's just getting
Yeah.
worse, guys, out in the civilian sector.
Well, there was a VSO that I heard say something, and I'm not saying that it's ours. It was just a VSO, and I can tell you that it wasn't ours. Just in all transparency, just so I don't get thrown through the mud. But this VSO said, if we keep sending the easy cases to the private sector and the money follows them, who pays for the specialized VA units that handle, say, spinal cord injuries, blindness, or combat related PTSD? I didn't know how to answer that. It just can't, this is something I was reading with it, and I was just like, that is interesting because they verified that it's a VSO that had said this about this. And, obviously as Combat News, we want to make sure that we're, you know, trying to look at all sides of this. It says they argue this isn't choice. It's a slow motion dismantling of a system that provides care private doctors aren't trained for. The accountability gap also is in question. While the private sector offers more locations, it lacks the same oversight. If a private doctor provides poor care to a veteran, the VA has limited power to discipline that doctor compared to an internal VA employee. Is the convenience of a shorter drive worth the potential drop in veteran-centric expertise? That came from an actual VS. Because I was looking up stuff and I was like, I couldn't believe that. I mean, it's from a VSO. I don't
That's
know what kind. I don't know if it's a DAV. Like, I don't know any of
but I'm
that.
just
But
saying, but that's my point. I mean, we're going to be up a creek, and I mean, I'm seeing a specialist, and the first thing the specialist said, "Hey, are you going to continue going to me once I do a test on you and figure you out, or am I just one and done?" And I asked him, "What you
interesting.
mean by what do you mean by that?" And he goes, "Well, a lot of times the VA guys come to me, and I never see them again.
Huh.
You know what I mean? Because the VA then takes over for care." They let the
Yeah,
doctor
that is.
figure it they let the civilian doctor figure it out, and then they take it over for care.
I wonder if that's kind of like what's happening with me when they're sending me out to rheumatology. Rheumatology's got me scored away. Now they're like, hey, by the way, those treatments that they're going to be giving you, we're going to have you come back to the VA for those and not through the hospital. But everything else you can do outside, though. But for that, you're going to come back for it. Is that
Yeah,
why?
I can let the doctor test me, probe me, and all that, but when they say, "Hey, this is your problem," what's the decision now? I gotta rely on I gotta go to the VA?
Interesting. So what do you think, Bill, that what could be done to try to meet in the middle? You know what I'm saying? Like, obviously if you have one side, where so we make sure that it's not what they can, quote unquote, and I use quotes, privatized, but still ensure the veteran is in charge and able to get the right health care, the right appointments, the right specialty doctors that they need in a timely manner. Do you think that they'd be able to meet in the middle, or do you think it's going to have to go one extreme and then say, we're going to have to, dig that back a little bit? What do you think?
I think that it's all gonna be very difficult to manage until there is a singular electronic health record,
Yeah. And they're running that
because
out, right? Aren't they running the electronic health record out in a couple places?
oh, yeah, they're putting I saw Doug Collins, the interview today. He's punching
Hmm.
out 16 different places. He's putting it on overdrive. But I believe that he realizes that that is the key, that you can send veterans out into the field to get services, but they have to be able to blend those services into the whole holistic plan of that healthcare provide for that veteran. And not being able to have the outside doctor understand where he fits in the overall plan is so important.
Yes.
He's lost.
Yes.
So how could he possibly know how to help you specifically if he doesn't know the specifics of how to help you? It's very
Absolutely.
difficult to understand
Absolutely. I agree. What's going on, Mike?
I finally agree with Bill.
that.
No, I agree 100%. I think that, when it comes down to even me with me trying to, look into moving and stuff, Bill, I actually talked to a realtor tonight and I was explaining, I was like, I have to take the VA into consideration. I need to contact the VA. How do my records get there? What's the best way? Are you guys a part of this? Do you guys have a pilot program I can send my shit through? You know what I mean? I'm
I
confused.
do it every time. When my doctor needs records, my civilian doctor, I get them from the VA and I bring them to him personally.
Right. But what about VA to VA?
No, I'm just saying is that look, the VA, they don't do it.
Oh, okay. So
They
so
don't
with
do
the
it at
VA
all.
system, just to let all of our veteran listeners, all of our people know, we have to, no matter where you are in the United States right now, if you move to another area, make sure you get your records, is what you're saying, and bring them with you. Okay.
No, okay, I'm
Oh.
talking, yeah, that's definitely should happen that way too, but, what I'm
Mhm.
saying is when you go to a community care provider and they ask for, "Hey, I need this test or I need the results from this blood work." I go to the VA and I get that. I can do it electronically, but
Okay.
I provide that to my doctor because the VA can't do it or they don't do it fast.
Tracking.
Yes, well, just like Bill's saying, an electronic health record is it's gonna matter a lot.
Yeah.
It's the key link. It really
And
is.
that so Bill, that would help a veteran like me who is moving not have to get my records and make sure that they're uploaded correctly into the new system.
Yeah,
Bro,
there wouldn't be any uploading. It would already be
yeah,
there. It'd be
already be
Got it.
there.
sitting in the cloud. You'd be
But
able to
So
pop it right down.
screw
so
the
when a
fact that you're
veteran
moving. No, screw the
What
fact
about
that
if
you're
a
moving.
vacation? Vacation. What about vacation? You get hurt on vacation.
You can go to the ER. Fuck you.
No, no, no. I mean, no, no, no. I'm saying, but what if you're sick on vacation? Like, yeah, a medical history, it's combat related, whatever. You get, it's part of your disability. You're in another state. You go to a VA. What happens then? It's just all word of mouth.
Huh?
If you need help at another VA, say I go down to Myrtle Beach vacation, I get hurt while I'm golfing or something. And then I have some problems, complications with it, stuff that I have, that the VA is dealing with, say rheumatoid arthritis. You're telling me that we have to just advocate for ourselves and tell them, hey, believe me, this is what I'm dealing with. I'm part of the VA system type of thing. They have no record of you. They have no idea who your doctor is. Nothing,
Hey,
right?
Bill, I mean, Marky, well, I think we're talking about two different things.
No, I'm asking about the electronic health
I
records.
know.
What?
I think we're talking about two different things right now. What I'm
No.
talking about what I'm talking about is an electronic record. This I would love to see this, and Bill's saying this is gonna happen. So when I go to my community care provider and he says, "Sam has got a," he's an asshole, the VA can read that.
Right.
We're saying, let's fix that problem first because you going on vacation is awesome, but you only do it 2 times a year.
No, I'm talking about VA to VA. That's where the electronic health records come into place. If I go down to the VA in Myrtle Beach because that's the hospital I need to go to because I fell on medical emergency, they're not going to be able to know anything about me
No,
without this electronic health records?
No, they just punch your shit in. I've been in that situation. I was down in Virginia Beach in July of last year, and I had to go to the emergency room. They were able to bring it up.
So isn't that electronic health records?
No, we're talking about when I went
They
to,
were
for
actually able
example,
to bring up what, Sam?
yeah, okay. So what I in September I went to go see a specialist. The specialist said I want to do this test and this test. I just had the test 2 weeks ago because the VA and the fucking people couldn't communicate because they don't. My doctor in the civilian sector can't see my VA record. And my VA doctor can only see the community healthcare one if he sends it.
Right, but what did that when you were on vacation in Virginia Beach did they see from your VA records? They can
saw
pull
that.
up your VA records?
Yeah, they were able to tell me I could get services. I mean, I was there
Oh,
because I was sick.
right. But they're not able to say, oh yes, you do have cyberviculitis or diverticulitis. You know what I'm saying? They
Oh
can't
no,
tell you that kind of stuff.
I wasn't there for that reason. But I was trying to say is if we could just solve the community care and VA problem with an electronic health record, that would solve a lot of people. 90%. You going on vacation is important. I get it. You need that. But what I'm saying is, I don't go on vacation, and I just want to get a test. And I want my doctor and the civilian doctor to talk and be able to look at shit.
Right. Okay. So if you drive to the Buffalo VA and you get injured, God forbid, crossing the bridge right by the VA, and they send you to the VA to get help, the Buffalo VA would not have any information on you.
No, they would. They just pump my social security number. I mean, I call around
I
the
thought
country.
that
I get
has to
everything in
do.
Arizona.
I thought that had to do with the electronic health records, though, like being able to communicate
Oh,
and
I
have
don't know.
everything bounce
I've
around
never
from
had that
one.
problem.
Isn't that what it is, Bill, or am I mistaken? I'm just trying. No, I'm asking an honest question because I just wanted to make sure I'm not going crazy.
Right. So when you are sitting in South Carolina, you can access My Healthy Vet. You can see all of your stuff. You can see your blue notes. You can see all that stuff.
Yeah,
They can't.
that's what I
They
was
don't see
wondering.
that unless they are sharing part of the electronic health record holistically across all of the VA. They're going to have a silo of information that does not speak to any other place.
That's what I was wondering about
That's
because
the
it's
situation.
not about the vacation side. It's just
No,
if a
if
veteran
you're on
is
vacation
outside.
and if you're on vacation, you get hurt and you go to a VA facility, they will know that you're a VA guy. They won't know your health record from Rochester.
Got it.
They
That's what I
can't.
was wondering.
They
Okay.
can't see it. They won't
And
know
this
all
would
of your
help,
health
though.
stuff.
Yeah,
That's the issue. They'll know that you're a veteran. That's easy to figure out. But you'll know you qualify. That's easy to figure out. But they don't know your specific health care in records.
They can't pull up my doctor's records. They couldn't pull up my test results.
That's
They
the
couldn't
electronic
pull up.
health record.
Got you. That's what I was I just wanted to make sure I was understanding what that was all about. Okay.
Yeah, all those notes and stuff that you can access
Yep.
through your blue notes and all that, they can't access that in another facility because they have a silo of information.
So
Each one has a silo.
with these facilities that are starting up doing it now, is it just going to connect those facilities? How does that work? Because it said like 9 of
Those are
them.
the ones that'll be live with the record sharing. Exactly. One specific health record carried across the entire system with
So if you're a part of that
loss of
system,
information.
only if
What's
you're a
that?
part of that system.
Only if you're in one of those facilities that
Tracking.
can accept the electronic health record as it is. See, what happens is when even in each city, like the Buffalo, the Rochester, whatever, each one takes the system and manipulates it into their own way. So and so when you do that and I do that and Sam does that, each one is manipulated a different way. Then you try to share the data. Okay, well, hold on for a second. That brown fuzzy liquid, You call it soda, I call it pop, he calls it Coke. Well, who's got the record that says they're all the same thing? That's what they gotta figure out, you know what I mean? So
Yeah.
everyone's got these different definitions of the exact same thing. Someone's gotta put a dated dictionary out there and saying, "Hey, man, this means that, means that, means that, means that," in all these places, and it fits here in the record. So when I share it with you, it's space 17 through 24. That's it, and everything has to
Mhm,
fit in that thing. So when I share it
mhm.
with you, everyone gets the same pieces of data in the same record format, so they can be parsed out and dropped into the system, so it makes sense to them across the board.
Yeah, absolutely. I hear you on that. And I know that we had another segment that we wanted to talk about. Did we still want to go into that segment, or did we? What do you want to do? Because it's all record. I mean, we do what we do. Let me see. Segment
Well,
one, segment
the
two.
last segment was more of a community thing, and it was a we love our community. Our veteran community is Rochester has probably I can't imagine anybody having a better veteran community. We're the home of the community chest. I mean, volunteering is in our lifeblood, right? And Rochester is very, very good at it. And the Veteran Outreach Center, one of our veteran organizations here in town, is very powerful and very useful for the veteran community, right? And we really appreciate all the services that they do, right? There's no doubt about it. Now, when we look at the Veteran Outreach Center as an entity, right, across the scope of veteran agencies that are out there, right? They're always looked at with a fine-tooth comb by watchdog organizations, if you will, are always looking at the percentage of monies that are being allocated towards services versus overhead. And one of the things that, unfortunately, with our group here, they have a high administrative and fundraising overhead. So that was one of the things that it popped up for us in our area is that's kind of a bummer for us that we really like the services and stuff, but it's getting a bad name. We're hoping that, somehow we can figure this out to help these guys out, because the overhead is significant compared to other organizations that are similar to them nationally. So I
Absolutely.
don't know, what's going on, but man, I don't, it would be great if we could figure out how they could have like a better rating because they're like a not recommended through Charities for Vets and they have a really good score in other ones. I mean, they're explaining that they phenomenal platform, compassionate local support, but the efficiency metrics is what they're talking about on the evaluator. So that's one of the things that I don't know, what the scoop is with that, but we really like the services. It's just we would hope they would have a better reputation, I guess.
Yeah. And when it comes down to non for profits and organizations, I believe that we all, and I believe the listeners always believe the same thing that we believe is that we need to do more for the veterans and less for the people that are doing for the veterans. You know what I mean? We understand people need to make money, but we don't need to take more of it.
Yeah, so it says that they have a staff intensive model, which is each and every one has said that. So I don't know, what that particularly means, but
Now
in the
you
long
use
run,
their
the
services
services
too,
are
right?
great.
What can
I
you
use these guys all
Can
the
you
time.
explain a little bit? Explain in detail a little bit about the things that you do because
Oh, it's
I'm a participant of the VOC services as well. I do the outdoor group and whatnot. So, but can you explain a little bit? Because I know you do a lot more.
every Monday I go and I do what's called Meditation Monday, which is it's a breathing exercise where you go through and you basically set an intention and then you realign your chakras through a breathing program. Right. And then on Wednesday, I'm going to do a chakra realignment with the Reiki massage folks there. So I do this all the time. One of my favorite things to do because they help. They're very dramatic in the way that they make you feel better. Right. So I enjoy it very much. Right.
Yeah, yeah.
I don't know their model. I don't know whether, there's a payment involved or any of that kind of stuff with those folks, but I know that those services are great.
So what you're really pretty much saying is that you enjoy and you appreciate their services, but when you come across as a veteran who appreciates the things that you're getting out of it, when you see things like that, it's
It's
upsetting, and you
disconcerting.
hope that
Yeah.
there's
It's
a
like, man,
reason for it. Yeah.
Yeah, these are my guys, man. These are my buddies. I don't want them to look bad.
Yeah.
This is something that kind of doesn't necessarily look good for them, right, in the overall, and I don't want them to look bad because these are the people that are providing me the services that I enjoy. So I'm hoping that we can I don't know what to do about that.
Yeah.
Well, Bill, you're talking about the VOC's overhead, right?
Yes, sir.
That's why my personal VFW wouldn't contribute money, because my point was the VOC's overhead is almost so 30% of what you're putting towards it, 30 cents on the dollar isn't going towards a veteran or going towards a program.
Right.
And my point is, but here's the kicker. The VOC is doing stuff that nobody else wants to do.
That's true. I mean, the quartermaster services are second to none. I mean, those are I mean, the laundry services, the that when veterans go there and just hang out in that social center,
Mhm.
it's amazing. It's exactly right. The things that
But we
probably
don't
aren't
want organizations to look like something they're not. If they're not that way, then we need to make sure that they're not looked at that way, and that's what I
Yeah,
think
I
Bill is
don't want
stressing.
them to be looked at poorly. That's the thing that's bothering me. I don't want that to happen. I want them
I
to
agree.
not be like that. You know?
Yeah.
Do
Yeah,
you
and maybe
realize
they
that
can adjust fire
do
a
you
little
realize
bit.
that do you realize their advertising budget is bigger than some of budgets that of other programs? Just their advertising.
But where do they
Like
advertise?
the I think they spend like 150 to 200K a year. Go ahead and look it
But
up.
what
It's
does
on their
that
annual
mean?
report.
But what does advertising mean? Does that mean I mean, that could be a lot that's vague, right? So that could be
Well, I mean,
brochures, that could be
if
anything.
they like, for example, the public market, I'm sure they pay for that space for the veteran stand
Mhm.
down. I'm sure they get it at a discount, but I'm sure they pay for that space. Insurance has got to be paid. There's got to be paid. My point is
Mhm.
that's advertising, right?
Yeah, I hear you.
But I'm just saying is they spend
But I
more
I
to
think it
advertise than some programs service veterans. And that's their that's double what their budget is.
yeah,
And
so
those
maybe
people
they
do a
just
bang up job.
maybe they don't know that they're being looked at from these websites and from these places that are doing these analysis that way, and maybe that they now that they hear this, or maybe we bring it to their attention, and they can adjust fire, or maybe they ask how can we better do this, to make, because I find it hard to believe that they would that they're do that they don't mean harm. Maybe they just it's an adjustment of numbers pretty much. You know what I'm saying? They're doing programs that are good, they're doing this that is good. If numbers and they're being looked at a certain way, especially by places that don't know them, they're not in the community,
Right. That's the
maybe
thing.
they
They
will
have
take
no
it
idea.
into
These are just the
consideration.
independent
Okay,
judges.
so there's another aspect to it too that we don't know. Okay, and this is a good question because I know that when you receive certain grants, for example, if I get a grant, and so this happened recently to somebody I know, they spent the money on what the grant would let them spend the money on, right? Because it says so much of this grant goes towards administration, so much of this grant goes towards this, so much of this grant goes towards that. Okay. So what it is, this person went and bought a bunch of equipment, and everyone goes to this person and says, "Hey, we have people starving over here. Why are you spending money on this equipment?" Because the grant says I have to. Do you see what I'm saying? For me to get the
Mhm.
grant, I have to provide soda pop for everybody every time that might be the condition of the grant.
Right.
You and I might see it stupid, like no one drinks the soda pop. Why do you buy it? But the grant says I have to do it,
Yeah.
or I can't spend that amount of money in the grant. Does
Yep.
that make
Right.
sense?
Because they received some of that money from Tom Golisano, and I know that some of that money was earmarked where they had to do facility upgrades, and I guess that's why they were doing the redoing the foyer.
But to see, and
So
then
it was earmarked towards that.
that hits their overhead, right? Like
Mhm.
percent. But the grants they might have received, like the Galvesano grant, might have went towards administration and salaries for extra because of construction. And then so we don't know that full
Yeah.
story there.
Yep. Well, and that's what
Right.
coming together and unifying is all about. It's about, yes, we as Combat News, we come with issues, yes, we do, but we also come with it from the heart, and we don't want organizations, especially in our area, organizations, to look something that they're not. And now, if an organization is looking bad, trust me, we will expose them. But Bill goes to their stuff. We just don't want people to look bad on a national level or on any level.
Yeah.
There has to be a reason for things, and I think that we can bring it to their attention and maybe change it up a little bit. Maybe we
Well,
just need to
this
they
is
need to
where
finagle some
this is
numbers.
where we can now reach out to the VOC, and maybe Bill can sit down with the representative and ask them these questions. They should be able to answer them
Yeah.
in a
And,
professional manner.
and I bet you they'll be able to fix it too, because I'm sure
Or
that they didn't look at it that maybe they
or
didn't look at. I'm always a firm believer is
or
that
maybe they can
they don't know until
explain
they.
why. Maybe they can explain
Yeah.
why. Hey,
Yeah.
we're at 30% because this grant right here kills that number because of this, 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 and this.
Absolutely.
See what I'm saying? Maybe we just one of us, Bill goes there a lot, but I'm just saying, just goes there, not a confrontational, but just saying, hey, I've got some questions. Who can
Yeah.
answer them? My name is
Yeah.
Bill. I'm from Combat News, or my name is Sarge. I'm
Yeah.
with Combat News, and go
And
to them
and
and say, hey,
And devil's
why is
advocate,
this?
Blank, devil's advocate, when they, were on the news saying that the federal government took away $500,000, if the federal government could go to websites and see that they're outstanding and they don't have this kind of, record or whatever, verbiage, rhetoric on these pages, maybe they'd be more in tune. I'm just being hypothetical, but you know what I'm
Yeah,
saying?
yeah.
We want to change it to where if people look up our organizations in our area, they know, bam, you could send money to them. It's going to be great. We don't want people second guessing. That's our whole point, right? I mean, we don't want people second guessing. And when they're complaining about money being lost, we always have to think, okay, well, is there a reason for it? Well, if we see these things, or if veterans are sending these things that you can just type in ticka 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 ticka, and you can see that they're not recommended, that kind of doesn't look good on a bigger stage, and they might not know that that might be harmful. And here we are trying to help them because we utilize them. We want to make sure that they are thriving.
But I'm just saying is maybe we should talk to them.
Yeah, no, I agree. Percent.
Ask them. I mean, you send an email to Laura, send an email. Who do you feel comfortable with talking with? And then just follow up on it. And then you edit this live right here so we can plug it before you do the interview. See what I'm saying?
Yeah, no, I agree
Did
100%.
we lose Bill? Oh, there
Nope,
he is.
nope. But yeah, so I think
Oh,
that's good. What do you think about that, Bill? I love my new chair. Sorry, guys. It's so comfy, man. Thanks, mom.
he installed his own dildo on the bottom.
Where is it? What kind of chair is it from? What is it? An X chair?
Look,
It rises to
oh,
the occasion, he told me.
see it? It's got a pillow up here on the top, right here. It's got a pillow, and it's got a lumbar pillow. But the lumbar pillow plugs in. It's got a USB port, and it plugs in. And goes brrr, helps my lower back or wherever you put the pillow.
No, what it is for the vibrator to charge
That
up.
was Army, not Navy.
That's why you needed a vibrator. We don't have fucking power. Yeah.
But you know what's awesome in my podcast room? I'll tell you guys. So the recliner I used to sit in is now on the other side of me. So like Zinni was just sitting there watching us do the beginning of the podcast. But I can have like guests and stuff just chill out here now. It's pretty cool. I'm pretty excited about it.
Why don't you invite
When
me over?
Zinni and I are going to do a little podcast. Bill, what do you think about this? We're going to hit the little kid side of things and talk about how veterans, kids, the effect, the life, you know what I mean, what he lives with and stuff. While we're doing all that to make things a little bit, not so tense, we're going to buy a case of MREs. And every episode, we're going to taste test an MRE with Zinni and see what he thinks about it. Oh, man. But I
Gonna
think the kids, I
have him
really,
roll the dice. You get
yeah,
the
well,
vegetable one today.
yeah, we'll do that. We'll mark them all, you know what I mean? But I think that it'll be good for us to interview him, talk to him, and see what it's like to be, a kid in the community. He's very patriotic. He's very, Americana, America first. Um, he still doesn't really understand. He does understand, politics and government and stuff, but he's learning and he wants to learn. And we want to push those younger generations to know these kind of things and to be able to openly speak, their mind about America, about politics, about how they feel. And I think coming from, I mean, you guys know Zinni, he's very well spoken. He's very meaningful with how he talks. I think it'd be pretty cool. But I think some veteran kids will get some more veteran kids to talk and to join forces with him. Maybe some JROTC kids.
I
Combat News. We're gonna keep
I think it's
expanding the
great.
episodes.
I think it's great because maybe younger people will come in and ask questions like, "Should I join the military?" And you'll be there, right? You know what I mean? You'll be there. You could answer questions.
Yeah.
"Oh, you're going in the army?" I'm saying these are all things, right?
Well, Zinni thought of a great idea. He was thinking, kids might watch it and say, "Hey, maybe I can talk to Zinni about what do I do if my dad's having a nightmare?" or things like that. And I was like, "Wow, that's these are the kind
That's
of things
deep.
that are pretty." Yeah, but that's
Well,
cool to have somebody that's willing to take the bull by the horns. You know what I'm
but
saying?
the other thing about it is, Marky, is that means that he might be seeing things at his home that he knows that other people can benefit from. He's been lived with it too, right? You know what I mean?
Yeah,
I mean, you're
yeah.
no peach.
I'm a plum, baby.
I may
I'd call
steal
you an
your
asshole,
diamonds,
but
but
I'd call you an
bring you
asshole.
back some gold.
Mexico. So, what do you guys think about the open forum on Wednesdays? I think that was pretty good. This last Wednesday, we actually it was one of our more viewed and came to spaces. Man, I mean it was great. I think we networked a lot. I think people understand us now. A lot of times, and I wanted to tell you guys this. I don't know if you guys heard this, but they were a lot of people were they were supportive of us, but it seemed like it was more New York centric, which obviously, yeah, we're from New York. We're going to talk about New York stuff. But now that I believe that we have the Veterans Open Forum on Wednesdays at 1900, where it's just a unrecorded space, we're just kumbaya and shooting the bull. I think that we're having more people come in now because now it's more, hey, let's all of us come together and I think it's gonna just boom, to be honest with you. I think this is what the veterans really needed. I think they were just scared to tell us, hey, let's not have so many topics. Let's not keep it so newsy. We just need the fellowship. We just need the camaraderie.
They just want the
And
kumbaya, baby.
yeah, and we listened, right, Bill? We listened. We adjust fire, and anytime we need to adjust fire, we're going to. And Bill had a great idea about a new segment, a rally point. We're gonna think of some new things that we can do to continue to bring what is needed for the veteran community: the good, the bad, the ugly, the stuff that maybe people say, "Oh, you're walking on eggshells." Well, guess what? That's what veterans do. But we're gonna make sure it's factual. We're gonna make sure that we're not just using our platform for a Joe Blow session. You know what I mean? When we talk about candidates, when we talk about things on, with conversation with Sarge, it is directly for that. What am I trying to say? That segment, right, Bill, is what I'm trying to say. So combat news isn't the umbrella, and the segments that are underneath, it's a direct reflection of those segments. What happens in those segments are from those segments. It's not. Can you explain that a little bit better, Bill, just so people can understand as we continue to grow, in the next upcoming months?
Yeah, because Combat News as a company, right, as a holistic umbrella, Combat News, we put veteran policy in perspective. And underneath Combat News is the Veterans Open Forum, which is an open group held by vets for vets, right? So that's a place where we do our open, everyone can come, talk, and whatever. We're also then going
Amen.
to
Yes,
do
sir.
more structured segments where we go dive into more newsy things or a specific deep dive into a subject where it won't be a specific, maybe open forum. It'll be more news specific and detailed. And then we'll get reactions to that. And we'll use those as kind of like the platforms to begin looking at these other segments that we're looking for. So we're just kind of like feeling around, trying to find different areas where we can add value to the community and also be specific where we can really help. So, we're trying to mash talent,
Yes.
experience, and opportunity with the veteran community and find exactly where we can add the most value.
Yeah, and we're always looking for more people to, because like we say, we're all combat news. So if you're in another state, and I know all of our supporters, some of them I think will understand where I'm coming from. If you're in another state and you've been with us and you understand our mission, you want to, be combat news Michigan, please let us know. Let's make it happen because we want to make sure that the veterans are getting their information in their area and also all information from all areas. So if you can help and you want to step up and specialize in your area, please reach out to one of us and we'll guide you, we'll help you. You're probably already part of the team already, but we are all Combat News. So this is not a for-profit. This is not a monetization. We're just trying to make sure that veterans get what they deserve, and I don't know if you've seen up when I posted it up here, but if you click the link there, subscribe to our YouTube page. Our YouTube page is where you're going to find all these videos, guys and gals, all of our conversations with Sarge, all of our up and coming new episodes that we have, all of these episodes that we do here. If we're out in the community and we upload, we're going to put all of our stuff to our YouTube page. We believe that it's easier for everybody to watch, to share. You can watch it on your kids' tablets. You know what I mean? We know that because I have kids and they grandkids, and we know these kind of things. So YouTube is accessible all over. So once again, I'll post it up there so you guys know. If you click the link, subscribe to our YouTube page there. But it is, if you go to YouTube and you type in Combat News NY, you got to type in Combat News NY, and it will come up. You'll see our videos. Follow us on our Facebook page, Combat News site Facebook. That's something that you can do if you're not already following. What else do we have? We have at Sarge SGT Mitchell 8 on X. We have Bill. Can you state what your name is on X?
Gables.
At 5 Gables on X, and blank is at, what is yours? At blank Combat News. I believe that's what it is. Combatnews.org. But if you follow one of us, you'll see the other ones. So I just encourage everybody to do so. As we continue on into 2026, we're going to have events. We're going to get back into golfing. So you will be seeing some awesome and hopefully entertaining videos for you to further understand what we do in the community, other veterans, especially golfing. You're going to see a lot of golfing videos because we're going to be, we do a lot of golf, and we're going to be across county lines. We're going to be within the state. Anytime we're at veteran golf events, I can assure you I will have our camera with us, whether we attach it to the cart while we're interviewing people, whatever. But we will bring you this year, we promise you, the actual peer-to-peer, real life, boots on ground, raw, unfiltered, what we do, because that is what Combat News is all about, right, Bill? We have built something to where veterans feel that if they need something, they know they can come to us, whether they need a hand up in a sad situation, or they need help with finding something to do for the day. They know that we are trying to do what is right by them. And I think that it's just so encouraging going into 2026, knowing that we now have the video option of showcasing our fellow veterans who mean so much to us, who bring us the joy that they don't even know. They think we're bringing us the joy. Nah, man, you guys are just empowering us. And I encourage all veterans to just keep up the good fight, man, because without you, we're not anything. You know what I'm saying? Without you, we are not Combat News. And together, we are Combat News. What you got to say about that, Bill Blank?
Did you see where we're going to the driving range next week?
Can I tell you something about that? Zinni's
Webster,
jealous.
baby.
Zinni's jealous.
Gonna
You know
go
why?
see your pro, Sarge.
No, that's it. Don't do that. This is a podcast. Don't do that. No. She no. I'm blushing.
Oh, yes, you are.
That's Zinni's coach.
Yeah,
That's
sure.
Zinni's coach.
Yeah,
That's
could be
Zinni's
coaching
coach.
something.
Oh my God. She is such an
Yeah,
awesome,
so Sam,
awesome.
why did we switch from Big Oak to Webster? Do you know?
It's cold.
No, I think the reason is that Webster reached out to Tracy or her organization and said, "Hey, we really want you here."
That's very cool.
Yeah, so that's what's happening now. People want us there.
Yeah. And I hear that a lot, Blank. And I know we talked offline about some things, but with this conversations with Sarge, and that's why I'm so happy to have these, more segments branching off of Combat News, because I feel that each segment is going to be able to reach a different niche of people. You know what I'm saying? And with conversations with Sarge, we actually have an amazing, I just want to put this plug in, guys, real quick. Battle Rattle Liquor. Okay. They are here in our area, and you're going to hear more about them, but they are literally farm to bottle, and they're giving money back to the veteran community. They want to know who is good to, donate to and all that, which is a blessing, because we don't ever want to choose. We don't want to say, oh, come to us and we'll decide. No. We're going to give you the pros, the cons, and a list of 15, 20 different places, and you guys decide. But we're going to make sure that out of that list or in that list is all places that you do not have to worry about. Does that make sense? We don't want to be choosing. No, you choose what fits your mission best. And I'm so excited to partner up with them because I know that what they're doing. And when you hear this gentleman's testimony, I believe it's going to be a 2-part. And I want to let you guys know that I'm about 90% sure we're going to make it a 2-part. And the second part, I would like you guys to come with me because we're going to go
Taste
on
testing.
site. We're going to go on site. Well, I'm going to have taste testing while we're doing the podcast. I told him, I said, I got to try it out. But we're going to go there and taste it. We're going to see how they process it. We're going to talk to them and we're going to get an in-depth feel of what this operation is. But I know that they're going to help in their area for anything that we have with Combat News, with everything that we have with the veteran community, peer-to-peer support. What they're doing is so huge. And we know as the little guys, it's hard to get yourself out there. You have to earn your keep. You have to earn your seat at the table. And we always have to remember that. But what we do have to always remember as well is that as we all move up through the echelon, so to speak, of the veteran community, we have to make sure that we don't forget where we came from. We have to help each other out. So one hand wash the other in a positive way, not in a corrupt way. So with us helping them, they're going to help the veteran community that saves our life. You know what I mean? And that's what's cool. I want to link them with the PFC Dwyer program and all that. So we're going to have a
Oh
blast.
no.
It's going to be great.
Oh no, Sam, are you going to start eating?
Look at this guy. He's metamorphic Power Ranger. But I appreciate
I'm
you
pretty
guys, man.
sure.
And Sam is losing his marbles. He's having a good time over there. But I appreciate you guys so much. And we're gonna have some more news coming out, here in a little bit. Please make sure that you follow us on our social medias. We're gonna keep blasting things out. We want to keep the veteran community up to speed, up to date with everything going on. Bill, do you have anything in closing besides
I
Sam
think we're
going
all
wild and
good,
out over
bud.
there? I love it, man. Well, I appreciate you guys so much, man. I can't do it without my amazing team here. And for our listeners, please give my amazing team a round of applause because without them, without their support, without them keeping me in line, yelling at me, trying to tell me what I couldn't do without them, man. I used to do it by myself. It was very hard and stressful, and now I have a team that can hold on to some of the weight. And with all of our support that we have, you guys are holding on to all of our weight because together we are Combat News. So I
Together
appreciate
we
you
are
guys, man.
Combat News.
And please listen to our anthem. If you ever guys hear the music that's playing in our stuff, that's a Combat News anthem. So listen to those words, man, because I'm telling you, they hit home a little bit. And if you listen to them in your vehicle, it sounds real good, man. Let me tell you what, it'll make people be like, "Oh, what's that song? Oh my God, I can't believe
You better
it."
do some serious editing, just so you know. We got 59 minutes of bullshit.
No, it's not 59 minutes, Boaz. You take
I
care.
think we lost it.
Yeah. Check the mic, 1, 2, this ain't no drill, this is the truth. From Roxas to streets, hear the veterans' youth and the wisdom of ages. Battle hardened and true, Combat News on the air.